think there's anything closer to probably a single payer or universal health care than we have in Hawaii. Could you respond to that?
So I think obviously Hawaii was ahead of its time in the Prepaid Healthcare Act, which does provide employer coverage for folks who work full-time. And my understanding is that the delegation has worked to make sure that the Prepaid Healthcare Act is protected in whatever form of the health reform bill that moves forward. So by ensuring that we at least have some continuity of coverage and not losing our health care coverage is very important in Hawaii because it does provide a sustainable funding stream.
Protected mean we're exempt? Can we exempt?
My understanding is unless the benefits in the health reform bill exceed what is currently authorized or included to the residents of Hawaii in the Prepaid Healthcare Act, then it would not provide for less coverage. If it provides for more coverage, procedurally I don't know the means that it would come out, but my understanding is that at this time Hawaii's issues with respect to the Prepaid Healthcare Act have been addressed and inserted into the health reform bill. In looking at some of the unique things that we do in Hawaii that the rest of the nation can learn from, I think that what's very obvious to all of us is because of our geographic isolation and our non-contiguous structure of our state, it really encourages us to be more cooperative in across our health care delivery system. So we're very interdependent, and as a result of that, we dialogue with one another, particularly within our association, because we represent hospitals, long-term care, home care, and hospice, about ways that we can collaborate. So if you look just at, say, a hospice eligible patient, you know, the opportunities to reduce the cost of care by enabling those folks to move out of the hospital into either a hospice or palliative care program. I think that we continue to strive for excellence in those programs to be able to keep people in their homes receiving those services at end of life. We do have telehealth programs. One stood up on Maui many years ago, and I think that continuing to explore ways to utilize telehealth as a means of avoiding additional, more costly ways of delivering care is something that we continue to explore. We do have challenges in maintaining specialty care providers, and as such, particularly on our neighbor islands, I know there are ongoing discussions about how telehealth might help to fill those gaps where we can look at utilizing resources here on Oahu to reach out to
the telehealth you're speaking of include the HMSA, where you can get on your computer and the cam get you in front of a doctor and
right, there's so many different versions of it. That is one where they make it a little bit more accessible to patients if they can't actually.
Is it working out? Is HMSA having a number of? I mean, not that I want a proprietary secret, but you know, is it being utilized? Are people signing up? I know I signed on, but I never actually utilized it. Fortunately.
You know, I'm not really
not up to
speed on what what HMSA's.
It sounds like a good option if you're in the middle of the night.
Sure, we have to get creative, and I think the go ahead.
So, Cora, where are the pukas in our system? You said essentially, if the Obama administration and the Universal Health Care Act doesn't trump ours or doesn't give us better than what we got, we have the opt-out. We have steady as you go our own health care. I think that'll be reassuring to probably many people in Hawaii. I didn't realize that. You're probably sure that that's the case.
I've had discussions where I've received direct feedback from the delegation with respect to that.
I find that rather reassuring that there's not going to be a big discombobulation. But where are the pukas in our system? We're not perfect. We've got emergency room care and all those sorts of things. We've got rural clinics that are lacking.
Sure. I think the best case study to demonstrate where our pukas are is this issue of waitlisted patients in our state that we've worked with the legislature to raise awareness and receive support for. What waitlist represents is Well, they are patients that are in acute care hospitals that we can't get out of acute care.
Acute care means what?
Hospitals.
Just a hospital. Because
Correct.
people on the street, when they say
Thank
acute care
you.
versus long care,
Thank
one
you.
means
I
you're
know
going to get fixed up. You just go in there, you got a problem,
Sure.
they fix you up, you go away.
Right, so you're in the hospital, you've completed what services you need in the hospital, and you're ready to go someplace else, whether it's a long-term care facility, if you need rehab time, or back to your home. We're having difficulty being able to move them out, and what happens is
From the hospital,
From the hospital.
to the long-term care.
Correct.
So there's nothing wrong with the acute care, nothing wrong with the hospitals in the system. It's after they get out of there when they want to go into long-term care, which we know is expensive and with few beds.
Right, and we use the term broadly really to say post-acute care. So it's anything that comes after the hospital. So they may be able to be serviced in their home, they may be able to be serviced in a care home, they may be able to be serviced in long-term care. It really depends on what their needs are. But where we're finding that the PUCAs are that contribute to that dilemma include we don't have the perhaps enough capacity in the right places, or the right types of services in the right places. What we look like on Oahu is very different than what we look like on Oahu. We have challenges where the reimbursement doesn't cover the cost of care. And as a result of that, a provider who wants to receive that patient isn't going to be able to cover their costs, so there isn't an incentive to move the patient.
Our neighbor island legislators always remind us of that very, very, very fact. Dr. Maddock, I'm also a graduate of the University of Hawaii, and we always learned that if it walks like a duck, looks like a duck, sounds like a duck, behaves like a duck, probably it is a duck. Coral has basically said that if the national healthcare, universal healthcare, single payer, whatever is going to come forward, and it doesn't match or exceed what we have in Hawaii, do we already have universal healthcare in Hawaii? Do we already have essentially the coverage that the nation is trying to get? I'm not trying to make us look good, but it sounds like, of what she said, could it be
I
true?
think what we're missing is for the unemployed or underemployed. So those of us that are working 20 hours or more a week are covered by state law with health
Right.
insurance, which is wonderful. But it's that gap with the people that are unemployed. We know unemployment is rising right now. We're seeing more and more people are losing their health care. We're seeing people with pre-existing conditions that are denied health care. So
But aren't the ones that are going to the emergency room those individuals?
those are those individuals, yes.
Because we can't by law deny.
That's where, yes, but they're going to the emergency room because they don't have any other options. And I think, what we would get through universal health care is we'd fill the gap groups, the people that don't have insurance right now. And Coral probably knows the percentage of people in Hawaii that
Yes, Coral, do
are
you
not
know?
covered.